I'm Dr. Sujata. In this video, I'll be talking of different types of glaucoma. There are four major types of glaucoma: primary open angle glaucoma, angle closure glaucoma, normal tension glaucoma, and secondary glaucoma. Coming to primary open angle glaucoma, this type of glaucoma is said to occur when the damage to the optic nerve is due to increased intraocular pressure in the eye. The pressure can be a result of factors other than angle closure. Angle closure refers to the physical closing of the normal drainage pathway for the fluid of the eye. So, what causes an increase in the IOP? The possible causes include overproduction of the fluid and reduced outflow of the fluid from the eye. Primary open angle glaucoma is the most common type of glaucoma, that too by a large margin. It progresses very slowly and its symptoms may be experienced only after many years with the disease. Symptoms include reduced peripheral vision or increased clumsiness due to vision changes. The risk factors for open angle glaucoma include high eye pressure, family history, age, high myopia, diabetes, high blood pressure, and eye surgery or injury. Coming to angle closure glaucoma, this type of glaucoma is different from the primary open angle glaucoma in the sense that the cause of high intraocular pressure here is the physical closing of the natural fluid drainage pathway in the eye. It is known as the angle closure because the location of the drainage pathway is at the corneal angle, at the edge of the cornea and within the eye. When this corneal angle closes or narrows down, the fluid is unable to flow from the eye, resulting in increased pressure. The symptoms of this include eye pain and it's very sudden onset. It is mainly an inherited disorder. Angle closure glaucoma is a lifelong concern. Coming to normal tension glaucoma, in the above two types, the glaucoma was due to increased IOP. However, in this type, the damage to the optic nerve is caused due to a mix of factors other than increased IOP. Despite the normal pressure in the eye, normal tension glaucoma brings the same symptoms as other types of disease. Now, secondary glaucoma is where other conditions causes glaucoma. Here, elevated eye pressure is a result of an existing condition and secondary glaucoma occurs due to prolonged eye pressure in the eye. Secondary glaucoma develops due to conditions such as recurrent inflammation, prolonged steroid use, and cataracts. There are some more types of glaucoma diseases which can be named as pigmentary glaucoma, pseudoexfoliatic glaucoma, traumatic glaucoma, neovascular glaucoma, IC syndrome, and congenital glaucoma. To summarize, the only way to treat glaucoma is by altering the eye pressure, and this is mainly done either through eye drops or surgery. If one gets secondary glaucoma treated, it can reduce the risk of further damage. Long-term management is vital for all glaucoma types, so one needs to continue visiting an eye doctor for a long term.